Assalamu alaikum wa rahmatullah. This is Naz Rahmatullah and welcome back to my channel. I would also like to apologize for the long post. I've promised to upload a part 3 of Let's Talk About UTI. And inshallah today we'll talk about what are the signs and symptoms of UTI. In the previous video, we have discussed about what UTI is in details and also what are some of the preventive measures that we can take to protect ourselves from getting infected bi'idhnillah. Inshallah today, and this will be the last video inshallah, we will talk about what are some of the signs and symptoms of UTI. How do you recognize these signs and what are the treatment and what are some of the things that you can do to protect yourself from having reoccurrence of UTI inshallah. So we have some few signs and symptoms that are very common that we would like to take today inshallah. First is called frequency and urgency. Like when you often visit the toilet or the restroom to pee often, and when you have the urgency to go and you cannot control your urine, like you cannot hold it for a long time. So this is because the bladder is inflamed and irritable, and therefore it contracts often. It contracts frequently. You understand? So this is why you always have that frequency, like you often visit the restroom, and then sometimes when you go, it's just a little that will come out. That's number one. That's a sign of UTI. And the other one is called dysuria. Dysuria means when you have difficulty in peeing or difficulty in urinating, where you feel pain while you are urinating. Now this is because the lining of the urethra, remember we discussed about in the previous video when I was describing the urinary system, I mentioned the urethra. So the urethra is that tube that brings the urine out from the bladder. That is that tube. So this urethra, the lining of the urethra becomes swollen. It is inflamed. You understand? So when it is swollen, and then of course it is that same tube that will bring out the urine from the bladder. So it is due to the swelling and the inflammation of the lining of the urethra. That is why you feel that pain. You understand? So that is called dysuria. When you have difficulty while peeing, understand that the urethra is inflamed and it is swollen, so it will hurt. Sometimes you feel burning sensation as well while urinating. The other sign is when you have lower abdominal pain. Lower abdominal pain. Now this is because the bladder is inflamed and it is swollen and it lowers down the pelvis area. So this is why you feel the pain. When the bladder is swollen, it's inflamed, it lowers down the pelvic area. So this is why you will always feel pain. Some will tell you, I have waist pain. A lot of patients will come and will complain, I have lower abdominal pain and back pain. So all these could be signs and symptoms of UTI. Sometimes also when you urinate, your urine will be cloudy, and sometimes it will have a very, very, very strong smell. These are all signs of UTI. A healthy urine should be faint yellow. Faint yellow, not thick yellow, but faint yellow, like faint yellow. That is how a healthy urine should be. It should be very clear, faint yellow, very healthy. It should not have any strong smell. So when you see these signs, you need to report to your healthcare provider as soon as possible. You go to visit the hospital. Do not diagnose yourself. Of course, it's very important for you to understand that these are signs and symptoms of UTI, but then do not just maybe buy over-the-counter drugs to think that, okay, when I take this antibiotics, it's going to go. No, you have to go to the hospital so that you will get tested, go to the lab, and they will do urinalysis on you, and inshallah when they finally diagnose you with UTI, they will give you the treatment. So how do we treat UTI? First, you have to know the preventive measures first. so that you can couple it with the treatment. Otherwise, sometimes when you're given treatment from the hospital and you are not protecting yourself, you're not practicing the personal hygiene, as I mentioned in the previous video, it makes it very difficult for the antibiotic to work. So get yourself tested, go to the hospital, and inshallah, when you're tested, when you are given antibiotics, make sure you complete the dosage. There are some people that sometimes when they go to the hospital and they give them prescribed medicines for them, once the symptoms disappear, they stop taking the medicines or just stop practicing how they should be practicing, like the personal hygiene. That is not how it's supposed to be. When you go to the hospital, inshallah, and you are given medicine, please complete the whole dosage. Don't just tell yourself once the signs disappear, you are also don't do that. You understand? In rare cases, you have fever. In rare cases, you'll be having fever, you'll be having waist pain. You understand? And if it reached that stage where you have fever and it's causing you fever, then it's getting serious. You understand? So these are some of the things that we should always report to, and we shouldn't diagnose ourselves. I hope I'm just clear. I'm not sure if I'm making sense, but I believe you understand what I'm trying to say. So let's just take a recap of what we did in the previous video. For those that did not watch it, we talk about the preventive measures. But I will advise, inshallah, you watch that. So drink a whole lot of water, and practice good hygiene, especially down there. And please do not take some of these feminine products that are not medically advised or not medically proven to be okay. It happens, I'm not sure internationally, but locally here we have a lot of sisters that make some of these chemicals and will tell you to use it down there. You understand? I had this funny meme that says, how can you trust somebody who failed chemistry back in school and now is mixing chemicals to tell you this is good for you and you're trusting them? So if these feminine hygiene products are not medically advised, do not take them. Because if you're taking them, it's going to make it will be very hard for the antibiotics to in fact work. Like I tell a lot of my patients, I tell them the antibiotics given to you by the doctors or the nurses or your healthcare providers, they can only treat what is already inside. But then what goes inside of you, you should be the one to control it. You understand? Because you taking the antibiotics and then using those feminine hygiene products that are not medically advised, you understand, or other local products, it will be like one is digging a hole and the other one is returning the sand back. So therefore your system will become resistant to the antibiotics. So it's very important that we watch out for each other and then share the message, because UTI is something that really disturbs a whole lot of women. It disturbs us so much. Like I said, it happens to men too, but it's very common in women more than men due to our anatomical structures. So inshallah, this is what we have for today. I pray that Allah subhanahu wa ta'ala makes it easy for all of us and get this UTI away. The more we spread awareness, the less people will be affected, because there are people that do not actually know about UTI. And of course, sometimes when patients come to the hospital, because sometimes the hospital setting, especially here in Africa, is always busy, so we don't have the time to counsel patients, to tell them this is what you need to do, this is what you need to do to make sure it doesn't come. So what you should do to protect yourself, to prevent it from reoccurring, is that you should couple taking the antibiotics with personal hygiene. If you do that, it will be easy for you to control it, or it will not come back, inshallah. So inshallah, we conclude with that. I hope everything is understood, and if I've said anything that you don't understand, feel free to clarify or ask questions in the comment section. Or if there's anything you would also like to add, like I said, we watch out for each other, we're here for each other. If there's anything you would also like to add, please feel free to add it to the comment section. Until next time, inshallah. Assalamu alaikum wa rahmatullahi. Thank you so much for your time.